Good morning, everyone. I hope you can hear me okay. My name is Glenn Robert. I am the Vice Dean for Research and Impact in the Faculty of Nursing, Midwifery and Palliative Care at King's College London. And it's my pleasure to introduce and chair this webinar around our postgraduate research programs in the faculty. The webinar will last for about an hour. We'll finish 11 o'clock UK time. And the schedule is, I'm going to give a brief introduction to the faculty. I'm then going to hand over to Dr. Mary Leamy, who is our Associate Dean for Postgraduate Research Studies. And Mary will take you through the types of PhD programs and what to expect from doing a PhD at King's. We'll then hear very briefly from each of the postgraduate research coordinators in our 4 research divisions in the faculty about the types of PhD research studies that are conducted in each of the divisions, with some examples of current studies. Mary Leamy and her colleague Bethan Page will then talk about how to apply and what to look for in competitive PhD applications. And then we'll hear briefly from 3 of our current PhD students who have very kindly agreed to join us this morning and share their experiences. And then we'll try to leave at least 15-20 minutes at the end for any questions you may have. Great. Please do feel free to use the chat function in Zoom if you have any questions, and we'll try and pick up any questions in that final Q&A session at the end of the webinar. Right, I am just going to share my slides and give you a brief introduction to the faculty. Great, okay. Hopefully you can all see my slides. So yes, the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care, and this is all about our postgraduate research programs. Oh, I'm trying to put that on full, so there we go, great. So the faculty is directly descended from the Nightingale Training School, which was established by Florence Nightingale herself at St Thomas's Hospital in 1860. It is also home to the Cicely Saunders Institute, the world's first purpose-built Institute for Research into Palliative Care, which was established in 2010. The faculty is part of King's Health Partners, an academic health sciences centre where world-class research, education and clinical practice are brought together for the benefit of patients. And in 2024, our faculty comprised more than 270 staff, based either in central London on our Waterloo campus or in South London at Denmark Hill, where King's College Hospital is based. And within the faculty, we have 4 education departments and 4 research divisions, including the Institute, Cicely Saunders Institute. And as I say, you'll hear from each of the postgraduate research coordinators in those divisions in a short while. We're very proud to be able to say that in 2025, King's College London was ranked first in the world for nursing in the QS World University Rankings by subject. And in 2023, King's College London was ranked 10th overall for the broader topic of health and clinical research in the Times Higher Education University ranking. In our research excellence framework, the last one was held in 2021, the next one's going to be in 2029, but in 2021, King's Applied and Allied Health Research was ranked first overall and first for percentage of world-leading impact, outputs, and environment. The number of papers with citations in the top 1% world, in the world in field, we were top in palliative care and second in nursing and midwifery during the period 2014 to 2020. And we are the only major London Russell Group university providing nursing, midwifery, palliative care and related interdisciplinary degree education. Just a few examples of some of our excellent work. We are world leaders in research relating to palliative care, co-design, intensive care nursing, and many more. We have 2 major international contracts for education in Nanjing and Xi'an. Our postgraduate tour experience survey results and our postgraduate research experience results, so these are surveys of our students, are consistently strong. We have leadership in teaching clinical skills and simulated learning for placement preparation. And just want to highlight a national award that we received for our international virtual electives, where we replicate the benefits of an in-person international elective for our nursing students by taking those students on a virtual journey through different global contexts exploring the unique challenges and successes of nursing in those regions. So I hope that gives you a very brief overview of the faculty and some of our achievements in recent years. I'm going to hand you over now to Dr. Mary Leamy, who's going to talk more broadly about our PTR programs. And I will stop sharing so that Mary can share her slides.
So Erica's going to share my slides for me. Thank you, Erica. Thank you very much. So as Glenn said, I'm Mary Leamy. I'm a senior lecturer in mental health and also the Associate Dean for Postgraduate Research. And I'd like to just give you a bit of a sense of the types of PhD program we offer and what you might expect from doing a PhD at King's. So we have 5 different postgraduate research courses. So the first type of research you might be interested in is to register as a MPhil student, PhD student in nursing research. And this is for anybody with a nursing background or any PhD proposal which has a nursing focus. We also have a specialist midwifery research program, which is again anybody that is a midwife or the PhD proposal is on midwifery or has a maternal health focus. For other academic staff or clinicians with different healthcare backgrounds, we have a health studies research program. We have a Cicely Saunders Institute of Palliative Care Policy and Rehabilitation PhD. And we also have a joint program with 2 universities, University of Singapore and Hong Kong University. So with a joint PhD, you would have a supervisor based at King's and also at Hong Kong or University of Singapore. And you can choose whether or not to be based in King's or in the partner university. If you're interested, please contact us and we can give you more information about how to do that. Next slide, please. Thank you very much. So what can you expect from our PhD program? Well, we have a PhD program team. You've met Glenn, and I'm obviously Mary, Associate Dean for Postdoctoral Studies. You'll be meeting our PhD coordinators, and we also have excellent professional services support from our Research and Impact Manager and our Senior Programs Officer. We have a wide range of opportunities for training and personal development. So for example, our PhD students can register for research methods modules, for example, in qualitative, quantitative or co-production and co-design. And within the university, you also have access to a range of courses that's provided by the King's Doctoral College and any course that's provided by the SkillsForge application where that's open to any academic. So a very wide range of training. If it's not possible to identify a course within King's, we also have funds to support people to apply for external courses, external training courses, and of course conferences. We have a vibrant PhD community. Some activities are arranged by our students. For example, we have a Research in Action group, which meets very regularly. And we also have a specific PGR journal club. There are other opportunities for attending journal clubs which have a specific topic related to a particular condition or discipline. We also have a range of activities related to seminars and research meetings. Our faculty provides a series of research seminars organised by each of our research divisions. And each year we have a faculty PGR annual conference, which is organised by a team of academics and students. And the King's Doctoral College also have a number of activities designed to help people get to know students, not just within their faculty, but within the wider university. So they have a range of activities, competitions, symposiums, conferences, and a buddy scheme. So there's many, many opportunities to get to know your fellow students. In terms of networking, there's opportunities and activities to help you get to know the rest of the faculty and your research division staff. And we also have, we actively encourage you to attend conferences to increase your network, both nationally and internationally. Next slide, please. So what might you expect from your PhD programme? Well, in terms of academic supervision and monitoring, we have a model where you either have 2 or 3 supervisors. You'll be meeting them very regularly, in person or virtually, and they would be giving you regular feedback on your written work. They would be probably the first person that you would contact in terms of having pastoral support, and they will be working with you to identify training courses that are targeted around your particular research interest, but also to help you with your personal development. In terms of monitoring your progress, we have a range of ways of doing that. We have a regular online progress report where that will be completed by the student, by the supervisory lead, and by the PhD coordinator. So we check that you're able to set targets that will make sure that you're progressing on time, and that we monitor that closely. We also have a thesis progression committee, which is comprised of 2 external experts, so usually within the research division, but it can be within the wider faculty or within other faculties of the university if that's necessary. And they will be working with the supervisors to meet you regularly and to give you additional critical support and advice, and to support your PhD. We also have a formal way of monitoring your progress, which is called the upgrade, which is like a mini Viva, where we'd expect you to produce a written report and you'd be examined on the content of that report. There's opportunities to have pastoral support in addition to a supervisory team, and they will be provided by your PhD coordinators and myself. And we have many specialist advisors within the university related to welfare and disability, housing, finance, and visa. And we also had a dedicated career support advisor for our faculty, who meets with students on a one-to-one basis and has many really useful resources and activities to help you think through how to develop your career during your PhD and afterwards. Thank you. I thought it would be useful to mention that we have 2 different types of PhD. So we have a traditional PhD format where you would be writing chapters between 80,000 and 100,000 words. But we also have a format called thesis incorporating publications, which is a variant of this traditional UK format. And that includes being able to include journal articles which have been accepted or published, rather than actually having to rewrite your work as a traditional PhD. So a thesis incorporating publication is a combination of traditional chapters and your published work. Thank you. And lastly, before I hand over to my PhD colleagues, coordinator colleagues, we have, as Glenn said, we have the structure within the faculty of research divisions and teaching departments. So not all supervisors are located in the research divisions. So this is just a slide of some of our academics who supervise nursing and midwifery related education PhDs. So I'm going to hand over to Claire and Bethan. Thank you.
Do you want us to go next? Sorry, I thought it was Glenn next.
Yeah, I think it is.
Oh,
Bethan.
Sorry. Yeah, Glenn.
Yeah, thanks, Bethan. I'm going to pick up from here. So what we're going to do now is just have a very brief introduction to each of our 4 research divisions from the PGR coordinators. I'm going to start off talking about our methodologies division. So I will just share my slides once more. Let's get these up and on slideshow. There we go. Great. So the first of the 4 research divisions that we're going to talk about is the methodologies division, where I am the head of that research division. Our PGR coordinator is Dr. Thomasina Stacey. Thomasina is a senior lecturer in midwifery and maternal health, but unfortunately can't be with us today. So I'm taking her place. So the methodologies division looks at exploring the application and investigation of a wide range of methodological approaches. And the key areas of focus within the division include those listed here. So we have particular interest and expertise in sociological and anthropological studies of healthcare. So division members draw on disciplines such as sociology, anthropology, and others. We have a specific interest around health communication, including discourse and conversation analysis in healthcare settings. We have a very strong midwifery and maternal health research group, which Thomasina is obviously part of. We have particular interests around the co-production of health and care services and the co-design of complex healthcare interventions. And as Mary just mentioned, one of the modules that PhD students can take focuses on co-production and co-design. We have strengths around historical studies of healthcare practices and policy studies, and specific expertise around implementation science, and with the recent appointment of a new professor in the division, Health Inequalities Research. So those are the broad sort of areas that PhD students within the methodologies division might focus on. And just to give you just a few examples of current students. So we currently have over 20 PhD students within the methodologies division from a wide range of countries. You can see some of them listed here. So Bernice is studying the use of medical interventions during childbirth in Ghana. Marta is exploring the characteristics of different types of interprofessional teams in mental health care settings. Andy is looking at co-designing a culturally adapted family intervention for individuals experiencing their first episode of psychosis in Indonesia. Yongil is looking at the transition experience of newly graduated nurses using constructivist grounded theory. And Kanyana is looking at high-risk pregnancies, particularly in preventing type 2 diabetes among women with gestational diabetes in Thailand. So I hope those two brief slides give you a quick overview of the type of PhD studies that are undertaken within the methodologies division. I'm going to pass you on now to Professor Julie Sanders, who's going to talk about the second of our divisions, the Digital Health and Applied Technology Assessment division.
Thank you, Glenn.
Stop sharing so Julie can. There you go.
Thank you very much. So it's my pleasure to be able to introduce the data division, which is the Digital Health and Applied Technology Assessment. This is headed up by Professor Louise Rose, and our focus of research very much is on data, digital health or care interventions, and technological innovations in health and social care. We have three main clinical areas: critical care and patients with complexivity, trauma and resuscitation, cardiovascular care and wound care. And we're a very interdisciplinary division conducting research across a range of populations. We have a range of methodological expertise within the division as well. And we have a thriving postgraduate research programme and support clinical academic career development. So here is just a flavour of some of our supervisors within the division and the types of work that they do and supervise. We have 19 postgraduate research students currently, and Louise focuses on outcomes and experience of mechanically ventilated patients. But as you can see here, we have a wide range of areas that are covered, from out-of-hospital cardiac arrest that Claire Hawkes leads on, to mobile health and digital tools that Siobhan O'Connor is an expert in, and quality and safety of healthcare systems, for example, that Andreas Kyriakis is also leading in. So we have a whole host of supervisory expertise, as I say, with those methodological expertise as well. And here is some of our postgraduate research fellows. This is taken from one of our divisional events where our fellows presented to each other. And I'm delighted that you'll also hear from Andy and Haritza later on about their experiences. But as you can see here, we have a range of PhD students doing a range of projects ranging from acceptability and feasibility of interprofessional scheduling of point of care, ultrasound in ICU, to somebody looking at sleep and pain interactions in preterm infants, and to AI in palliative care with dementia. So we have a range of home-based and international students making up our vibrant research division. So thank you very much for listening, and I'll delighted to hand you over to Dr. Claire Ellis-Smith and Dr. Bethan Page, who will tell you about the CSI division.
Thank you, Julie. Claire, I'll just share the slides. Right, over to you, Claire.
Can you hear me?
Yeah.
Yeah, that's super. Thank you, everybody, and lovely to be talking to you about the Cicely Saunders Institute Palliative Care Policy and Rehabilitation. Bethan, next slide, thank you. My name's Claire Ellis-Smith. I'm an occupational therapist, and I'm also senior lecturer in palliative care at the Cicely Saunders Institute, and I'm the postgraduate research coordinator. And Bethan, do you want to quickly introduce yourself too?
Yeah. My name's Bethan and I do the admissions for Cicely Saunders Institute, and my research is around children's palliative care.
Super, thank you. At the moment, we've got, sorry, just back a bit, Bethan. At the moment, we've got 33 postgraduate research students at the Cicely Saunders Institute. 26 of them are full-time and 16 overseas. So we've got lots of countries represented, from China to Thailand to Zimbabwe to from all over the world. So next slide, please, Bethan. So a little bit about the Cicely Saunders Institute. It was first, the department was first created in 1996. And then in 1998, we developed the MSc Palliative Care, which is still going strong. It has students from at home and internationally, and it's got consistently high scores on the Postgraduate Taught Education Survey. It's Cicely Saunders Institute in 2010 became the first purpose-built institute for palliative care, which means that we are a building that hosts researchers and academics in palliative care, a clinical team in palliative care, and a education component. So we have undergraduate, postgraduate taught, and postgraduate research education. And together this makes a really strong integrated palliative care provision, where we work closely with clinicians in terms of our research program and education. We're also a WHO collaborating centre for palliative care and rehabilitation. Next slide, please, Bethan. Over to you.
Right, so this is just a slide showing some of the topics that our PhD students are currently working on. So we've got a number of students, for example, looking at care homes of dementia care. We've got a senior lecturer in health economics and palliative care supervising students here. We've got a growing team of paediatric palliative care. We've got a lot of research around breathlessness and a whole range of other topics here on the list. And as Claire mentioned, we've got a lot of overseas students, so we've got lots of research going on all over the world. This is our team. We also have some others that aren't here on the list, including some senior postdocs who've got specialties, who sometimes help with the supervision if they've got particular methodology expertise or particular topic area. We've got some global health researchers here as well. And we also, as Mary mentioned at the start, there are modules for PhD students. We also have a specific one around research methods in the context of palliative care. So I'll stop sliding now, stop sharing and pass over to the next presenter.
Hi everyone, as I'm loading my screen, can I invite Vasiliki to introduce herself as one of the care of long-term conditions PhD coordinators?
Hello, thank you, Ruth. I hope you hear me all. I'm Vasiliki Juvara. I'm a lecturer in mental health and one of the PhD coordinators for the care in long-term conditions. And then back to you, Ruth, to present the division. Thank you.
Thank you. I'm really delighted to tell you a little bit more about the care of long-term conditions. Vasiliki and I are really delighted to be PhD coordinators because we do see this role as being so important to support students and help them complete their PhDs in a timely way. So Our division is care of long-term conditions, so our research, as you would expect, is applied and incorporates co-development and evaluation of a range of interventions to support those who experience long-term conditions and help them to live well with long-term conditions. We have a range of research groups within our division, and you can see this list here. Our division is led by Professor Jackie Sturt, who has an expertise in diabetes, and we have a research group led by Angus and Kirsty that look at clinical diabetes. We also have another research group around mental health nursing research led by Alan Pearson. Myself and Dr. Joe Fitzpatrick lead older people research group. And we have a research group looking at bladder and bowel research, which bring research group led by Vladja. And we have a new outcome research group, which is led by Daniel Munblit, they're looking at patient-reported outcome measures, which is a really important part of research. So here are a few of our PhD they are our PhD coordinators. We are a larger division, so we have a range of academic staff with lots of different clinical and research methodology expertise. We do a range of studies, from a lot of evaluation studies using a range of methods, from clinical trials to realist evaluation, and also other qualitative evaluation methods as well. You can see we have a range of from diabetes to smoking cessation to a lecturer in emotional, Emma Rowland, with an expertise in emotional geographies of healthcare. So these are a range of our academics. We are, as I said, we are a big research division, so we currently have 36 PhD students, quite hard to choose a few to profile. So what we've decided to do is to profile our recent graduates. So these are the last 6 students from from Care of Long-Term Conditions Research Division who have completed. And they come from a range of different international contexts, from Jenny Birch, who looked at developing a toolkit following surgery for rectal cancer. Jane Hopping from the UK looked at how acuity and dependency is defined within district nurse settings in the UK. And then we have Dr. Ling Wang, who did a study looking at psychological first aid training. And Dr. Joseph Suklo from Ghana, who looked at family-oriented diabetic care. Sanji from looking at attitudes of women in the implementation of midwifery-led care in India. And then Xingwei Liang, who looked at co-design and feasibility testing of a group-based pelvic floor muscle training program. So you can see the range of studies that we have of students who have successfully completed a PhD, and obviously we're very proud of them. Thank you very much for listening.
Okay, great. Thanks for that. I'm going to, Mary, I think you're going to take us through how to apply and what we're looking for in competitive PhD applications, along with Bethan.
I am. So Bethan's going to start and then I'll take over.
Great, thanks, Mary. So the admissions Mary and I are going to talk through today, and Thomasina, who can't be here today, also leads on admissions. So we have a kind of a bit of a two-stage process. So the first thing when you're thinking about doing a PhD is to identify a potential supervisor or 2 potential supervisors. So the most important thing to start with is to have a look at our website and to think about some of the people that you've seen here on the slides today and who would be a good fit for you for the topic that you're interested in, and also the methodology. So it's really important to have the methodology expertise and the topic expertise. So we have an email address, NMPC-PGR inquiries you can get in contact with once you've got a research proposal, and they can help find you a supervisor. Usually students have had a look at potential supervisors and have come up with some potential good matches. Once you've got to the point that you've had an initial conversation with the supervisors and had a chat through your research proposal, you'll then be encouraged, if the supervisor is happy, to make a formal application. And we have a website here, which is called King's Apply. And there's lots of different things that you need to upload, including, importantly, your research proposal. And it's important that your supervisor has seen a copy of this and had some input into it. as well as things like your academic transcripts and certificates. We do 3 intakes a year, so February, June, and October. October is probably when we have most students starting, but we do have a number of students starting in February and in June as well. So do please read the information on the websites and use the NMPC PGR inquiries email that can support you with questions and helping to find supervisors. Every year we run an NMPC PGR studentship, which is one funded PhD place. So this particular scheme is advertised. We've just actually appointed our applicant for this year, so it's advertised probably February time, something like that, every year, and it does importantly fund either UK or overseas students. So it includes the fees for the PhD and also a stipend for living allowances. Well, I will pass over to Mary now.
You very much. So as Bethan said, it is important to think about your research proposal, and here's just a little bit of guidance about what we'd expect to see in your research proposal. So it's helpful to have a short description or an abstract of your proposal, just to help people orientate to what you're planning to do. It's really important to make sure that the aims and objectives for your research are very clearly set out. So I would suggest that you state them in non-technical language. So you have a very clear research question, and that it's very obvious how your research plans are related to your research questions. And if appropriate, you would have a primary hypothesis. So what I'd suggest is you think carefully about the balance between the background information and your proposed plan of work. So we do expect you to have a summary of the current state of the literature, so to show that you've engaged with the literature and that you clearly identified a gap within the literature that you can address with your research proposal. So we would like to see how your research questions, your aims and objectives fit the gap in the literature. So that's the purpose of the background, is to make a very strong rationale for why you need to do your PhD. And then the majority of the proposal should be about your planned plan of work. So we would expect to see this including the key aspects of your study design, depending on what type of method you use. Within the faculty, we have a wide range of expertise for most research methods, and if we can't find it within the faculty, we'll look elsewhere, but usually we're able to identify a match to your proposed methodological your methods. And if necessary, we can give you additional statistical support, either with expertise with the supervisor, or we can find external expertise and statistical support. So we'd want you to have a very clear description of how your research methods and your design addresses the aims of the study. So that's where we really want to focus, to encourage you to focus on. So please do that. And then it's helpful to have a timeline or Gantt chart. And here, this is where we can see that your planned work is feasible. So it's important to include a realistic plan for how you're going to spend your time during your PhD, and obviously add some references. Next slide, please. So I thought it'd be useful also to just go through what we're looking for when we assess proposals. So as Bethan said, it is very important to have those conversations and work with your potential supervisors so that they will support you to strengthen your application and strengthen your proposal. But essentially what we want to do is to have a good fit with the faculty. So this is why we spent a lot of time today giving you a sense of the range of expertise within our faculty. So one of the criteria is that any proposal would fit with the research interest and expertise within the faculty. So we need to have and be able to identify appropriate supervisors, and on your application, we'd like you to have a named supervisors. So that's why it's important to meet them before you submit formally. In terms of the quality of your research, we're looking at the originality of the research question, how clear your research question's aims and objectives are, and that the relevance of the research question to improving well-being and healthcare. So as I said, it's really important to give a rationale for your proposed research. We'll be looking at whether or not what you plan to do is appropriate for the scope of a PhD, and also that it's feasible. And that it's very clear what your proposed design and methods are, and that they fit the research question aims and objectives, and that you've included a realistic Gantt chart. So all of those aspects we'll be looking at very closely when we assess the proposal. In terms of other factors, we require you to have a good standard of English, but also that we're looking at your capacity for reflection and critical thinking, and that you have a really good existing knowledge and expertise regarding the research topic. So as please, the best way to contact us is this generic email address, and we will be checking and responding to you very quickly. I think that's my last slide. Yeah, so here's just contact details. Back to Glenn. Is Glenn still with us? I think Glenn may have left. Can we hand over to our PhD students now? Is it York first of all?
Hi.
Hi, York.
Hi, my name's Wilay Laksakrang, and I'm in the final year of my PhD at the Cicely Saunders Institute. My research focuses on implementing the Integrated Palliative Care Outcome Scale for Dementia, or IPOD-STEM, for people living with dementia in Thailand. This measure was developed by Dr. Alice Smith and her team at King's, and I'm truly honored to be supervised by Dr. Alice Smith and Professor Catherine Ewan, both leading experts in the field. I first became interested in King's while exploring ways to improve dementia care in my country, where palliative services are still developing. When I discovered that IPOD-STEM was developed here, the opportunity to learn directly from the team behind this measure became a major factor in my decision to study at King's. Its world-class expertise and meaningful global impact made it ideal place for me to pursue my PhD. My experience at King has been incredibly rewarding. I received outstanding support from my supervisor, from the faculty, the staffs, and fellow students. I also had the opportunity to take part in a range of research skill development session and course at King. This session has not only strengthened my academic and research skill, but also create a space to exchange ideas with fellow PhD students and staff. It's been a valuable part of my experience, helping me enhance my learning and feel connected to vibrant and supportive research community. And also, King also offers excellent well-being services, including physical and mental health support, and is one of the few universities that had its own NHS health center. What had meant the most to me is the sense of belonging. King has a wonderful, diverse, and inclusive community. Even though I'm far from home, I always feel welcome, support, and valued. And it's a place where people are genuinely kind, commit to helping you grow, both personally and professionally. And I'm truly proud to be part of the King College London. Thank you.
Thank you very much, York. Do we have Andy?
Hi everyone, thank you. I'm Andy. I'm from Indonesia. I'm a second year PhD student under the Digital Health and Applied Technology Assessment Division. My research explores how virtual and traditional journal clubs can support evidence-based practice among critical care nurses in Indonesia. I first applied at King's, I think it's quite a long time ago. It's 2019, it's before pandemic. But because the pandemic hit, that some funding availability is limited in Indonesia. And then I continued to search some opportunities through the joint PhD scheme that Mary has just discussed with us. And there's also some faculty-led research project that I think King's had also offered. And then finally in 2022, I secured full funding and received supervisory support from the faculty. My research has been supervised by Dr. Siobhan O'Connor and Dr. Dila Davis. Their expertise in their field. I just officially started my PhD in October 2023. I think the application at King's was smooth. Thanks for the admission teams for the regular updates. And having previously completed a master's degree in UK, I already have familiar with UK academic environment. And then when considering doctoral study, nursing at King's stood out as a top choice. And during my PhD journey at King's, I have benefited with many development opportunities, just like York has just explained, ranging from the online as well as the in-person training to the research webinars that hosted by the faculty and international experts. So yeah, looking forward to everyone apply. Thank you very much.
Thank you, Andy. And lastly, Harissa.
Yes, thank you, Mary. Hi, everyone. I'm Hariza. I'm from Indonesia as well, and I'm in my first year of this PhD program. I'm in the Digital Health and Applied Technology Assessment under Professor Julie here. And my research project is about disaster preparedness education. So I'm planning to develop an educational platform to increase Indonesian community disaster preparedness. So I've heard about King's and how well known the nursing program is since I was in my undergraduate years. So it's been a long time since King's has been in my list of targeted universities if I wanted to continue my study. And here I am able to finally pursue my PhD degree in King's. And since I enrolled, I feel that King's has been very supportive of me and my study. There are lots of training and workshops available, and very supportive faculty, very helpful PhD coordinator here. And of course, I have amazing fellow PGR students as well that we can share through our studies. And I'm feeling helpful, and it's been very lovely. And I hope that I can finish my studies strong, and we'll be welcoming all of you who wants to apply to King's. Thank you.
Thank you very much. We have a little bit of time now if people would like to ask questions. Or if you either put your hand up, I think, or put a message in the chat. I'm just going to have a quick look and see if there's any questions already. So I see my colleague Ruth has put a message in the chat to let you know that we're currently actually in Thailand. So we arrived on Saturday morning and just getting over our jet lag. But we will be working with Mahidol University. And on Friday, we have some time to meet with potential PhD students. So we're going to be offering either in person, if you are actually in Thailand and in Bangkok, in person one-to-one meetings, or if you'd like to get in contact us, we can arrange a virtual meeting. And what we suggest is that we're available to give you advice and feedback on research proposal, or anything you'd like to do in terms of finding out more about what it would be like to be applying to King's. So do get in contact if you have time on Friday afternoon. Okay. So Bethan's suggesting we say a little bit more about funding for PhDs. Bethan, would you like to start and I'll carry on?
Yeah, I can do. And thanks, Natalie, for posting in the chat as well about funding. Funding routes are really variable. We have some students, overseas students, that apply for funding from their home country. Sometimes that's through government schemes. Sometimes it's linked to the hospital they work in, and it can be really variable. And obviously, depending what country you're in, it's hard for us to exactly advise what schemes are available there. We have a number of schemes that get advertised every year in the UK. For example, some of our UK students apply for funding through NIHR. We have various other sort of charity specific or condition specific funding. We have some specific projects that get advertised every now and then, so that they are funded by an existing research grant at King's. So in these situations, there are kind of idea projects already there, and people are applying rather than coming up with their own research proposal. So funding is really variable. There's a really good website called findaphd.com, which does have lots of information on funding, which goes across all UK universities. We have the annual call, the faculty funded studentship that I mentioned in the slides when Mary and I were presenting on admissions. This is just one funded position, and it is quite competitive. So that is an option that's out there, and that can be any research topic and any methodology, as long as it's relevant to the faculty. Mary, do you want to add to that?
I just want to, we also have a list of potential funders that are supplied by the King's Doctoral College. We can perhaps put the link in the chat either now or later, but that is a really useful way of finding potential additional sources of funding. So we'll put the link in the chat probably after this webinar. Unless you could, yeah. What other questions have we got?
Mary, there's a question about Indonesia, from Indonesia. If they had already put in a proposal and it wasn't supported, can they resubmit a new proposal with a different subject, different topic?
Yes, they can. I would suggest that they contact us, so on that generic email address first of all, and we can give some advice. But yes, it is possible. And I see, Hilary, you've put a note that we're going to be in Indonesia, or I am, and my colleague is going to be visiting Indonesia in a couple of weeks. I wonder if it's worth actually listing the universities that we're visiting and when we're going, just in case anybody's on the call from Indonesia, and it might be useful to meet in person.
I'll put that in the chat.
Oh, you've got, somebody's already asked that question. Let me have a look. So there's a question about whether you can apply for a PhD in nursing with a background of pharmacology. I don't know if anybody would like to say any more about that, but essentially, if you have you could apply for the PhD in health studies, unless you're a qualified nurse, I suspect. But we might need a little bit more information. But essentially, yes, it is possible to apply for a PhD in our faculty, but it might not be the PhD in nursing program. We got. Thank you, Bethan, for the information about the doctoral funding database. So another question about how does the application process work with NIHR fellowships? Essentially, we would require you to do a similar approach, that you'd be identifying supervisors, and that you would need to apply for the scheme, the NIHR doctoral fellowship scheme, and also apply to the university. But the best idea is to get in contact with us before you make the application, identify potential supervisors, and we will be able to guide you through that process, so that we have a lot of successful NIHR funded PhD students already, and either your supervisors or the PGR team will be able to support you with that. Okay, so there's a question about home country. I think yes, it might be possible, but I think again that's quite a specific question about whether or not it's possible to have a supervisor for the home country. So again, I think the best approach is just to get in contact with us and we can discuss that further. But we do have examples of where we've got a supervisor from King's and one from the home country. Okay, thank you, Hilary, for putting that information about Indonesia. Are there any other questions or any questions I've missed? I can't see any. Please shout if there's any questions I've missed in the chat.
Hi, Mary. I think there is one that you missed about the in-person requirement for students that are not currently living in London.
Okay. There is an in-person requirement. So the regulations say that you need to be in King's in person for 6 months of your PhD. So there's some flexibility about the timing of that, but usually it would be expected that you would start at the beginning of the PhD, that you'd have a period of in-person attendance. But that can be arranged on we can discuss exactly the timing of that. We do have a lot of students that go back to their home countries and collect data for sometimes 6 months or a year. But there's flexibility within the regulations for you to spend some time away from London if that's what you need. Anything else? Anybody else like to say anything? Otherwise, I think we can call this to a close. I can't see any hands up, but no. Okay. You've got our contact details. Thank you very, very much for attending.
Mary, there is a hand up.
I can see. Okay, please ask your question.
Yeah, I put a question in the Q&A section just around the in-person requirement for students not living in London.
Okay, I answered that. Essentially, the regulations allow you have to be in London for 6 months of your PhD. So it's possible to have some flexibility about when that 6 months is, but to meet the requirements of the university, it has to be 6 months that you're based in London.
Thank you. Okay? So, thank you. Sorry, I meant for students who are home UK students.
Same.
Same. Yeah. Okay. Okay. Great. Thank you.
Yeah.
Great. Yeah. Thank you.
Mary, can you just so just to clarify that's 6 months over the course of your PhD?
That's right.
Or is it all in one go?
No. It's 6 months, and it can be divided up as and when it's most convenient. So that there's an element of negotiation. Previously, the expectation was that students would attend in person at the start of their PhD, that they would attend their upgrade examination in person, and they'd also attend the Viva in person. That's changed. So it's possible to negotiate when you actually have the 6 months, but as Hilary said, it can either be in one chunk, or it can be divided over the course of your PhD registration. Sorry, I can't hear you. Did you ask a question? Is it Pastor?
There's a couple of other hands up, Mary.
Yeah. Could I go to Natalie?
Hi, thank you. It's been really helpful. It was just a quick question about timelines. So if we were going to, say, apply for to start in October 2026, when would we be thinking about trying to contact supervisors?
I don't know if Beth wants to say anything, but as soon as possible. Yeah, as soon as possible. It's difficult without seeing the research proposal to get a sense of how much how much work that might be required. Sometimes people's research proposal doesn't need too much amendments, but also sometimes it's very helpful to have a number of drafts and sort of turn it around and make comments and ask you to make amendments. So my suggestion would be as soon as possible. But we do have different intakes, as we originally said. So we have intakes in October, February, and June. But please get in contact as soon as possible, and then we can work with you.
Mary, just to add that, yeah, there are some formal deadlines for King's Apply at the stage of making the formal application that have to be adhered to, and I think they should be available on the website. I'll try and find the link and put it in the chat. But it's important that you've had those informal conversations, as Mary said, with the supervisors first. So you do need certainly at least a few months.
The home student deadline is a lot later, isn't it? I think, Bethan.
Yeah, exactly. There's an earlier deadline for overseas students, and visas and things need sorting, so it does take a bit of time.
Thank you very much. And Carol.
Hello, everyone, and thank you so much for your presentation. I just want to ask if I've already applied for a PhD program, but I didn't have a supervisor who can be aligned to my project. Can I still apply again with a co-author from my home country?
I think it would be best to contact us first, so that when I spoke about the joint PhD, that's a situation where you would normally have a supervisor in the home country and one in the partner university. So it's unusual to have another supervisor in another university. It's possible, but we would need to talk to you. So please get in contact, and we can see what's possible. But Stan, usually we don't do that. So I think it's important to have a conversation with you about that.
Yeah, I see. And one more question. And if I'm applying for a part-time PhD, could I still be able to apply for a scholarship at your university, or it's only for the fully funded PhD candidates?
It's full-time.
Yeah, I see, full-time. All right. Thank you. Thank you so much.
Are there any other hands?
Morning.
Yeah. Hello.
Good morning.
Good morning.
Yeah, and I've been trying to connect, but I've been having network challenge. But at least for a few minutes now, I'm able to get into the network and start receiving information that I've passed across. I've enjoyed information that I've received so far about the PhD programs, when to apply, the proposal, which are presented on the line, which I've looked into it, and which I will get a response. I will be able to send my work very back to you very soon. Thank you very much.
Thank you. Okay, we've got 2 more minutes if anybody's got a last-minute question.
I do, Mary, just going back to this issue of, is it that students need to be living in London for 6 months throughout their PhD, or that they are just required to attend the in-person sessions?
They have to be living in London.
Okay, so you need to have a London address, London postcode, yeah?
Sorry. Let me double check with the regulations. I'm pretty sure you need to be attending the university in person. So we do have some students that live outside of London. So it's possible to do that. But the expectation is that you're attending in person.
For 6 months.
Yeah.
Okay, great. Thank you very much. Appreciate you
All
providing
right.
clarity.
Okay, thank you. Okay, I think we've come to the end of the webinar. So thank you very much, and please get in contact if you want any more information. But thank you very much for all the contributors, and I hope it's been useful.